Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE Protocol for reversal of cognitive decline. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. In the last several episodes we unpacked all the core components of the ReCODE Protocol and then brought them all together to give you a good overview of how it all works. And we also detailed the best practices for success that Dr. Bredesen has seen in patients who have improved for over a decade. Now, we're diving deeper on the cognoscopy and all its associated tests. If you remember from episode 10, like the standard colonoscopy received at the age of 50 to screen for and prevent colorectal cancer, Dr. Bredesen's firm position is that when we reach the age of 45, we should all have a standard cognoscopy to screen for all the potential contributors and risk factors for cognitive decline. All these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. It also helps us prioritize which areas need more attention and optimization for better cognitive function. One of the first areas Dr. Bredesen wants us to test is our genetics. Yes, our genes affect our risk for Alzheimer's disease, but in the overwhelming majority of cases, our fate is not hardwired into our DNA. There are certain genes that make us more predisposed to developing Alzheimer's and cognitive decline if the right conditions aren't met, like all the key areas we talked about on episode 33. The most important goal Dr. Bredesen wants us to achieve for this testing is to clarify whether we are APOE4 positive or negative. For years, APOE4 has been called the Alzheimer's gene because of its close association with cognitive decline. We can have one copy of APOE4 from one parent, or we can have even received two copies, one from each parent. It's been estimated that if you have one copy of APOE4, there is at least a 60% chance you can develop Alzheimer's by age 85. It's also been estimated that if you have two copies of APOE4, there is a 90% chance you can develop Alzheimer's by age 85. Now, this presents a clear risk, but by no means is cognitive decline guaranteed just by virtue of the genes. In fact, many of Dr. Bredesen's patients who have reversed their Alzheimer's symptoms have one or both copies of APOE4. Frank McNear, author of Defeating Dementia, who I interviewed on episode 19, reversed his Alzheimer's with the ReCODE Protocol. He's got one copy of APOE4. And there's a growing online community of APOE4s who have reversed cognitive decline or are preventing it altogether and thriving on the website apoe4.info. There are also population subset groups studied around the world, like in Africa, South America, and the Pacific, with a high prevalence of APOE4, with little to no recorded Alzheimer's or dementia. They eat their traditional ancestral diets and live in relatively rural areas, away from industry and urban living, if that's any clue. Now, my dad has one copy, so do I, and we have other 4s and 4/4s running around in my family. It's estimated that about 30% of the world population has at least one copy, and about 2% has two copies. But what is APOE4? Without getting too into the weeds on the science, because that's for another video, APOE4 stands for apolipoprotein E4. And all you really need to know right now is that this gene produces a protein called apolipoprotein E, which is primarily involved in the transport of cholesterol and fat in the bloodstream, as well as injury repair in the brain and amyloid clearance. Those with APOE4 can activate a chronic hyperinflammatory response in their bodies and brains if the right conditions are not met. APOE4s can lay down more amyloid plaque and clear less of it if the right conditions are not met. APOE4s can have exceptional issues with fat and glucose metabolism, being more predisposed to insulin resistance if the right condition. You get my point. Lifestyle factors, especially diet, are crucial for APOE4s. I'll dive deeper on this in future videos, but check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet recommendations. So, how do we test for it? These days, it's as simple as ordering a 23andMe at-home test kit. You can also ask your Bredesen-trained or functional medicine doctor as well as your neurologist to test for it as well. Again, Dr. Bredesen's primary target for this genetic testing is for us to establish and know our APOE status. Are we APOE4 positive? And is it one or two copies? Some other optional tests we take a look at for other genes related to neurodegeneration are APP, presenilin 1, presenilin 2, CD33, TREM2, CR1, and NLRP1. Armed with clear understanding of our APOE status, our individualized protocols can start to take personalized form. Up until very recently, the prevailing thought in science and medicine was that if you had APOE4, well, get your affairs in order because you're going to get Alzheimer's. Dr. Bredesen's findings reinforce that no matter what genes we were born with, it's what we do every day with the way we live our lives, what we eat, how we move, how we sleep, how we respond to stress, how we avoid or eliminate toxins in our environment that carry the most weight on how those genes express. This field is called epigenetics, and we'll get into it on future videos. And I'd love to hear from you. Are you APOE4 positive? Have you had a strong family history? What adjustments have you made to your diet and lifestyle as a result of knowing your status? Drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.